Healthcare workers tell our I-Team abuse on the job is out of control. Their concerns come almost 2 weeks after a stabbing at a St. Louis area hospital that left a nurse with a severed artery in her neck.
Our Paula Vassan spoke with nurses saying this is happening too often, and it's time for that to change. A warning, you may find some of the details and photos in this story disturbing.
Patient just started stabbing people in triage.
It's always been something's going to happen. It's going to happen one day. It's going to happen.
Bridgeton PD is also up there at the ER.
And it happened.
2 healthcare workers here, stabbed in the head, neck, and back by a patient.
DePaul is currently on lockdown.
They'll have lifelong injuries.
And this was an unprovoked, disgusting act of violence. I was literally nauseous and sick when I heard the news.
Because Shelley Miller knows it could have been her. The victims are her friends. She worked a 12-hour shift here the day before.
I can't even tell you how many times I've been slapped or my hair pulled or just shoved out of the way. Like you go to start somebody's IV, they're like, don't touch me, and they just push you out of the way. I had feces thrown at me. People fill a urinal and just chuck it at you.
The violence reflected here in this surveillance video we obtained from staff.
So this is the triage desk here.
Miller says it shows where her colleagues were when they were stabbed and highlights a pattern of violence. This happened about a year ago. A man comes into the emergency room, tries to punch a nurse, and then throws a chair at someone's head.
And this is what you go through?
Right. No one heard about this. Nothing happened, as far as I know.
We've talked with nurses inside and outside of the hospital system. This is the impact of attacks from patients. Bruises, stitches, and blood. Healthcare workers wrote to us about being kicked in the shoulder, scratched, bit, and slapped. Pregnant nurses have complained about being kicked in the stomach.
Do you think hospitals are turning a blind eye to the violence that's happening?
Absolutely.
We asked SSM Health for an interview. A spokesperson turned us down. But in an email, they say they're in part hiring more security officers, adding metal detectors, and enforcing more training.
Healthcare workers say violence on the job isn't just a problem here. It's pervasive, underreported, and getting worse. Many say change will only come with national legislation.
On the table, Senate Bill 4182. The bill passed in the House of Representatives. Now it's awaiting a vote in the Senate. If it becomes law, there would be national minimum requirements for healthcare and social service employers to prevent workplace violence. Right now, there's no timeline for when that could happen. Critics of the proposed legislation worry about cost and implementation. Advocates argue it would make workplaces safer, with improved staffing and better tracking of violent incidents. Because right now, there is no federal requirement for employers to record workplace violence, unless it results in death, restricted ability, or days away from work.
It's so frequent that you get injured that you don't really think twice about going back injured.
Trevor Wolf, a nurse with the Missouri Nurses Association, believes those injuries are often ignored. He says he didn't hear from police or prosecutors when he filed 4 police reports in 1 year for attacks that landed him on a stretcher. The reason, he says, is often because patient privacy laws make it harder for law enforcement to hold attackers accountable.
They need records from the hospital to do so, and the facilities block that access of records.
Despite the pain, nurses like Miller keep coming back.
I've been a nurse longer than I've been anything else in my entire life. That's who I am. It's part of my identity.
What do you think needs to change to make you feel safe going to work?
We have to have consequences for your actions.
Healthcare workers also say it's up to employers to improve safety with better staffing and more security, for example. Right now, Jamisa Rivers has been charged with 4 felonies over the stabbing of 2 healthcare workers last week. She remains in jail tonight without bond. Prosecutors say she could be back in court in the next couple of weeks.
More than 2 weeks after a stabbing at a local hospital, the paramedic injured said the violence should surprise no one.
Our I-Team has found new emails and records following the attack. Tonight, our Paula Vassan speaks exclusively with the woman stabbed and asks hospital managers if they're doing enough to protect their workers.
5 staples right here. I got 5 stitches on my back. I had blood and air in my lung. I'm angry because this should have never happened. This was something that was 100% preventable. This is something that, I mean, my life could have been ended. My friend's life could have been ended.
You're hearing from Kayla McMahon, a paramedic at SSM Health DePaul Hospital.
I've been there for 10 years.
Her last day at work was July 11th. She was sitting at the triage desk when a patient she never saw before attacked her, stabbing her 2 times with a butcher knife. She saw her friend stabbed in the neck.
And then I think I blacked out because I don't remember falling.
Did you ever expect that you'd be a victim at work?
We always said at DePaul, if it's not, it was never if, it was when.
Because for years, this healthcare worker says she and her colleagues have been begging management for more security officers and metal detectors.
And it fell on deaf ears.
As they've seen violence in the ER worsen, with attacks like this one from about a year ago becoming increasingly common.
I've called security, my own security office in my own hospital, and been put on hold while I'm dealing with a screaming patient in the background because there's not enough security guards. I mean, we've told DePaul, we've told SSM that we've needed safety. We've told them numerous times, and they wrote back, well, we're looking into funding.
Action was too little too late, says her attorney, Emily Calla.
This was a completely foreseeable event. This was a completely preventable event. And the measures that should have been in place to take care of their medical staff were not in place.
After more than 2 weeks of asking SSM Health leaders for an on-camera interview, they agreed.
Our top priority is always protecting our staff.
Since the stabbing here, Dr. Alexander Garza says the hospital system has hired more security officers, added metal detectors, and enforced more training.
Many healthcare workers had reached out to me and said they've been begging management for help for years, for more security, but nothing has been done. Why do you think they experienced that?
We're pushing up the timeline on when these things get rolled out. Part of that is listening to the staff, seeing what the issues are, and then acting on them. We're not going to rest until we take care of them and that we can provide that security.
For too long, McMahon believes hospital systems have often put profit over people. It's why she says her colleagues continue to work after witnessing the stabbing, cleaning her blood off the floor, even though internal emails we obtain from staff tell a different story. This email from SSM Health Management to staff soon after the stabbing says, leaders immediately began working with staff members most closely affected to allow them to go home and begin to process what had taken place.
No. And they sent nobody home. My coworkers that were forced to help save my life had to finish their shift.
It's why she says she's speaking up for coworkers, for herself, and for healthcare workers everywhere.
I don't want this to ever happen again. That shouldn't be a thing. We shouldn't have news stories of nurses being assaulted.
McMahon is now preparing to file a lawsuit alleging violence against staff has increased and not enough was done to protect them. A spokesperson with SSM Health says they can't comment on pending litigation.
For weeks, our I-team has been investigating the pervasive problem of violence against local healthcare workers. Now, investigative reporter Paula Vassan goes to a co-sponsor of a bill aimed at preventing this violence on a national level.
Since 2 healthcare workers were stabbed by a patient at SSM Health DePaul Hospital, we haven't stopped asking questions. We've talked with healthcare workers in our area who tell us this problem isn't unique to one hospital. And we talked with a lawmaker working to prevent the violence with national legislation.
I was punched 6 times in the face with closed fist.
She shoved me against the wall and punched me in the face.
She stabbed me under my spine.
And she grabbed me by my neck and threw me against a wall and pulled a knife.
Healthcare workers tell us attacks like this from patients have long been part of the job, leading to sometimes lifelong injuries.
It is heartbreaking to think that men and women who are in the healthcare field or social work field have their lives at risk when they go to work every day.
We spoke with a lawmaker behind national legislation aimed at preventing violence, Senate Bill 4182.
This is really a life or death situation.
The bill passed in the House of Representatives. Now it's awaiting a vote in the Senate.
But my problem, of course, is I don't have Republican support. We're working on that. I hope I can convince them. This is not a partisan issue at all.
If the bill he co-sponsored becomes law, there would be national minimum requirements for healthcare and social service employers to prevent workplace violence. Critics worry about cost and implementation. Advocates argue it would ultimately make workplaces safer, with better staffing and tracking of violent incidents.
So we do need to have that protection at the federal level.
Dr. Alexander Garza is the Chief Community Health Officer at SSM Health. He calls legislation like Senate Bill 4182 a critical first step.
clearly legislation helps. I think some of the parallels that you can draw are there's federal legislation against assaulting people that work in the airlines. And so that's not universal for healthcare workers.
We're told mid-September is the earliest the Senate could take new action on the proposed national legislation aimed at preventing workplace violence in healthcare. Republican Missouri Senators Roy Blunt and Josh Hawley tell us they'll review the legislation should it come before the Senate for a vote.